Okay, you would hook that up. To be honest with you, what you could do is just take this off and put this right on.
Oh, okay. But had I put it on like that, would it interfere with the...
Yeah, see, if they did it with a mouthpiece,
okay.
then you could do it like this.
Oh, gotcha.
Okay. If they couldn't keep their lips tight around the mouthpiece, then I'd go right to a mask, and all you have to do is just put it in. Okay. Okay. So you'd run this at what?
10, 15?
No. 6 to 8 liters a minute.
Oh,
You're recording it?
Yeah.
Yeah.
Well,
Yeah,
this
sure.
is a nebulizer, small volume nebulizer. So that's why it's a little bit different.
What?
And that'll last about 10
Cool
to 15 minutes. Okay. So
Is that cool aerosol?
this is for a small volume nebulizer.
Oh, small volume. Alright.
Right. So everything is set up, and you give them a breathing treatment. You listen to breath sounds. You're taking the pulse, the respirations, and when you listen to breath sounds, you hear the lungs begin to open up. You'll hear better aeration. Okay. So that tells you that the medicine is working on the patient. Okay. So after the treatment, you take them off and you put them back on the venting mask. Okay. At 50%, and you notice that the saturation is still 97.
At 50%.
What I would do as a therapist is I would leave them on the 50% for the next 2 treatments and spot check every so often. And if you maintain a 97% saturation, now when you come in after the last treatment, say, let's turn the oxygen down just a little bit. They're breathing easier. They're not short of breath. They feel more comfortable. And so you take it from 50% down to 40%. Put your saturation monitor on there and look. And if, say, for instance, you get 95%, okay, is that acceptable? Yeah. It tells you that you're on the right track in what you're doing. You always want to document, and you always want to keep the physician informed as to what's going on. And try to get a titration order, which means that you can change the FiO2 according to the patient's oxygen saturation. That gives you the autonomy to do it. And it's like, no problem, we can take care of it because we know what we're doing as respiratory therapists. So maybe a couple days down the pipe,